My name is Dr. Hilary Mabea, and I'm a gynecologist, obstetrician, and also a fistula surgeon. I teach at the Moi University School of Medicine and also run the Gynocare Women's and Fistula Hospital, which is a non-profit making hospital. We do free fistula surgeries for the last 10 years, since 2009. We also do Linda Mama program for free maternity for the government. This hospital is about 100 beds, and we have almost 100 members of staff. And we have been running our fistula program for the last 10 years. And this is a free fistula program where we do operate women who are having problems with difficulty in labor, and they go to delivery at home or in the health centers, and they end up getting a tear on their bladder or on their rectum, so they have leakage of urine and stool without control. So these are the women who are very poor in the villages, and they are not able to really afford their cost. And that's why Gynocare was built, all came up to help this kind of patients who did not have access to treatment. And then the other problem was there are very few doctors who are able, or who are even able to do this kind of operations. So they did not have access to health care or a place where they can get treated. And then we discovered that we needed to prevent the fistula. That's how we started doing Linda Mama, to help these women who don't have money to get to hospital, to get a safe maternity, a safe place where their babies and themselves can be safe to give birth in a good environment and clean environment. That's how we started the Linda Mama program, where we see deliver about 150 mothers a month, with almost 30 to 40 cesarean sections a month just from Linda Mama alone. The government pays 6,000 shillings for a normal delivery, and the government also pays 17,000 shillings for a cesarean section. We don't charge these mothers any extra money. Yeah, that's only money we receive from the Minister of Health, and we don't charge them extra money out of that. So we do fundraising to take care of our fistula patients. The same amount of money helps these women to get a free maternity and a free cesarean section. We have insurance companies that have come to support us, and for example, Resolution L, CIC, even government, KRA, Central Bank, KCP, Resolution Health, even others like AAR. They have come in because of the kind of work they have seen us doing. They have brought in their own patients, who actually, when they pay this amount of money, helps us now to run the free fistula program and also Linda Mama. This is actually the leading hospital in East and Central Africa, and among the 8 centers in the world chosen by FIGO. We have here, we have in Tanzania, we have another one Nigeria, right? And 2 or 3 Nigeria, and then Asia, Nepal, and India. So we are actually and Ethiopia, of course, and Uganda. So we have about 8 facilities, and Gynocare is actually one of the 8 facilities in the world that have centers of training for fistula surgery. The Minister of Health should come and put up some effort in training these doctors to get the skills, so they can actually help so many women who are in the villages who are suffering from obstructed labor, so they can get some kind of skills to really manage this kind of. But we don't have at the moment a training that is supported by the government. We only have NGOs that actually support training for fistula doctors. We don't have a program from the government so far. Despite the fact that we do free Linda Mama, we do free fistula surgery, we still pay tax. We don't have support from the government so far. And Gynocare being one of the top fistula centers, I would say, in the world, we have not had recognition locally. Yes, we have not had recognition locally, whereby even at the level of Beyond Zero, for example, where the program is actually passionate about fistula. We have never had a chance to get invited even for a function around prevention of fistula. Being the top center, I say in the world, I don't want to even say East Africa because, as I said earlier, we are among the top 8 centers in the world. But we don't have any kind of local kind of recognition and support. We only survive through external, international support. So I think my appeal, of course, is for leadership and people who are passionate about fistula, obstetric fistula, to come in and actually give us support, because 50 patients operated every month for the last 10 years. That could be a huge number of patients that have passed through our hands and they have a safe life at home. So I think with a bit of extra support, then we can actually make this a center of excellence that can be emulated in terms of care and also training. What I feel this hospital should be able to is to help mop out the many mothers who are actually out there waiting for surgery. We do operate about 50 patients a month, and I feel that the numbers are out there still high because most of the patients fear to talk about this condition, which is very shameful. Leakage of urine and stool uncontrollably is a very shameful condition. So most of our patients fear to come out and talk about it. So there are so many in the villages, because I see mothers who have had fistula for 50 years who come here for surgery, a whole lifetime of 50 years. So I think there are so many women out there, and they are very poor, so they have no access to information which can allow them know where the facility is. We have to pay some of these patients, we have to pay them transport to come to the hospital. So my vision is to see how to reach out to these women so they can be able to know that we are able to give them this life-changing surgery. They can access here and get operated. They can also access a few centers in the country. There's a center in Kitale, there's a center in Kisii, there's a center in Nairobi, Chama Hospital, and sometimes Kenyatta, which can make these women get access to care. But also our center is a referral center for the most complex fistula surgery. So my vision is to see this being a recognized training center, to continue training more doctors so that we can actually have doctors spread all over the country through the support of the Ministry of Health, so they can actually get skills and also help women out there. Of course, there are so many challenges given that this is a free fistula surgery. The national insurance, NHIF, covers a few patients who have the NHIF card, and this is a very recent development. Before, there was no fistula coverage in the NHIF, but for the last 2 years, the NHIF covers fistula surgery. But 3/4 of our patients, actually more, even 80% of our patients, do not even have a NHIF card. That means they have no access to these NHIF funds. A few of the women, we do pay for them the NHIF so they can be able to access this surgery, but we are not able to offer many. So if the government was able to really give these women NHIF cover so they can be able to be treated at no cost, then the government will help Gynocare to escape them financial challenges that they have to face. Because because when you give them free surgery, the cost of surgery is quite high. One patient maybe requires 100,000 for treatment. The NGO maybe pays 80,000, so the 20,000 has come from our own private treatment to cover the deficit. So I think the challenges are there, finances are there, challenges of getting other new doctors to do the procedures, and also nurses who have skilled in fistula surgery. We do train some nurses here from all over the country, but we need more nurses who are specialized in fistula care.